What's up guys? It's been so long. I know this video is coming out way later than you probably were expecting it. A lot of you have already started as day one pharmacists, so I do apologize for not bringing this out sooner. I've just been like super busy the last couple of weeks. So I know that you've already probably had your first day as a provisional pharmacist, in which case, congrats, you've done it, you did it, and that's cool. And yeah, you just have to do that for, several more days until you get your results. And yeah, no pressure at all, right? I still hope that you find some of this content entertaining or useful, or you can maybe apply it in your second day of practice or your first week of practice or whatnot. So here we go. Enjoy.
Check the mic and make sure it sound right, boys.
Now we've come to the second part of the video, which is talking about day one as a pharmacist, and this is really cool. So here are some tips and tricks that you can do to help prepare yourself to become a day one provisional registrant. Number one, breathe. I know it sounds new age, but just breathe. You have gotten this far, you have to relax and step into the dispensary. Things are going to be okay. Step two, or tip number two, have confidence in yourself. Have confidence in yourself and your training. It took you a lot of exams and stress, and you're very qualified. So have confidence in your skill set and your ability to make the right call. Number three, accept that you're going to make mistakes. It's inevitable. It happens to all of us. There's not going to be a single pharmacist out there who hasn't made a mistake. What you can do is you can take that concept and flip it on its head and learn from your mistakes. So go into work with the intention of knowing when you're making the mistake and just pick that apart, learn from it, and come in the next day in the dispensary as a better pharmacist. Number four, never commit to a decision unless you're 100% sure that it's going to be safe. You will be under a lot of pressure, both from the public and also your team, because now all of a sudden you are the person that both of these groups of people turn to, and you're expected to come up with a response there and then. My advice is to take a step back. If you're not sure about something, look it up. Don't be afraid to say, I don't know, or don't be afraid to ask for a little bit more time. It is a high-pressured environment, and the last thing you want to be doing is to be giving in to these demands and end up hurting somebody at the end of the day. So never make a decision unless you are 100% sure that it's safe. Okay, number five, establish trust in your team. The chances are these people who are working and supporting you would have been doing their job a lot longer than you have been qualified. So have trust in them. They know what they're doing. But flip side of that, know that you are the pharmacist and that you are able to see and assess situations through a different lens. You are aware of the clinical and legal and ethical implications of your decisions. So although your team is a great asset and you should absolutely utilize them, understand that you have a very unique perspective on certain situations. And don't be afraid to explain or bounce ideas off your team. Fundamentally, at the end of the day, you are the responsible pharmacist, so you need to be able to justify your actions. Number six really should be number one, but just kind of occurred to me that the patient should be the first priority. Yeah, so either way, none of this is in any order. The patient is your priority. You gotta understand that you are the single individual who stands between everything that's happened in a patient journey up until this one point and that patient taking medication and that patient commencing or continuing on a treatment plan. You have that responsibility, and whatever decision you make, you gotta put the patient first. Number seven, don't be bitter. This one is harder to execute than it is to just say. It's very easy working in a dispensary with all these pressures around you to grow bitter and to start hating your job. My advice is to try your best to understand that these guys, your patients, they all, like everyone that you are in contact with has a story. And so try and practice professional empathy when somebody is screaming at you because the prescription isn't ready or whatnot, and you're being blamed for something that's essentially out of your control. Just understand that, well, these guys don't actually know what's going on. It's up to you to represent the profession, to educate patients, and to educate your team as well. And so don't be bitter. Just understand that it's all a process, and you can't be the person who is making things worse. And just knows that being angry and bitter or frustrated, it's not going to do anybody justice, at least of which you. Number 8, take pride in your work. I mean, you're a pharmacist. That is pretty cool. At least I think so, but I'm also biased. Celebrate the victories throughout the day, however small. It's really important that you give yourself praise as you're working through the challenges that arise in the dispensary. And so, yeah, take pride in your work and do a good job. Number 9, take care of yourself. Now, we all have worked in a pharmacy, and we all know how stressful it can be. It's really important that you are able to decompress. And this doesn't necessarily have to happen outside of the dispensary. You can do this during your shift. Just maybe go into the consultation room or go into the staff room. If something has really affected you and you feel like you're on the verge of breaking down, just excuse yourself, granted that the situation will be fine, that you're going to be absent for a couple of minutes. Just take a breather and go and decompress and come back to work. And number 10, last but not least, have fun. Now, I know it's difficult when you're trying to put out fires in a dispensary and to be having fun whilst doing it, but this is such an important aspect of any line of work. Know again that you are now the pharmacist. You are the expert of medicines. You are the person that people turn to for help, for queries. Like you gotta handle a lot throughout your day. But that doesn't mean that you can't have fun while you're doing it. Now, I absolutely agree that there is a fine line between taking your work seriously, as well as knowing that there is a life outside of the pharmacy. But it's up to you to determine where that balance is. But yeah, having a laugh in the dispensary with your teammates when it's appropriate, it does wonders. It just really helps boost morale and help set you up as well as the team for the day ahead. Okay, bonus rounds. I have 2 practical tips, which I absolutely swear by. Tip number 1, compression stockings. Yep, we all know what these things do. We've all came across them in a dispensary at some point, and they're not like the most attractive of garments, but they do absolute wonders when you're on your feet for 8 hours a day. I actually started using compression stockings about a year into being a provisional registrant. It makes such a difference. It's like literally night and day. Your feet are just less fatigued, your legs feel fine, you don't have swelling. It's great. You can actually run a marathon after your shift. Maybe that's an exaggeration. Tip number 2, peanut butter. If you're allergic to peanut butter, by all means, don't eat peanut butter, but I love peanut butter, and it's packed full of protein and energy and calories, and it's just delightful, I can just eat a whole tub of this if I could get away with it. Sometimes when the dispensary is just getting a little too much and you're just needing a little bit of that me time, whether it's on your lunch break or your tea break or whatever, just a spoon of peanut butter or the equivalent that's not going to kill you would do absolute wonders. It could be Nutella. Again, if you're allergic to hazelnuts, don't eat Nutella, but you get the idea. And that's all I got for you guys. So thank you for those of you who have stayed to the very end. I hope you have enjoyed this video and you've found it useful in some way. For those of you who are sitting the exam in July and November, best of luck. I think you will surprise yourself on just how much you actually know at this point. So have faith and best of luck on day one as a pharmacist. You're gonna kill it. Not literally, but you're gonna do great. If you have enjoyed this video and if you like the stuff I do, I'm gonna hopefully post more on this channel. I'm also working on a website. I have an Instagram account, so I'll post all of that somewhere. Let me know in the comments below what kind of topics you want me to cover more, or what kind of stuff you want to see more of me, if you want to see more of me, that is. Yeah, I guess that's it. Keep safe and stay curious.
It sound right, boy.